And did you know that TSH alone is completely, wholly inadequate and inaccurate way to diagnose thyroid disorders? How many of you guys, like all of you guys, have said that you had normal thyroid labs? Well, did you know that the only thyroid test that's needed, quote unquote, by all the endocrine medical official societies is a test called TSH? Okay. And did you know that TSH alone is completely, wholly inadequate and inaccurate way to diagnose thyroid disorders? Okay. It is not even actually a thyroid hormone. It's not made by the thyroid. It's made by your brain. It's not even a measurement of one of your thyroid hormones. It's just what your brain thinks is going on. Anyone who has a brain that's confused already, could it be confused about your thyroid? All the freaking time. So all these places are saying, just do a TSH, not even a thyroid hormone. It's a thyroid stimulating hormone made by the brain. And we're going to use that one test to diagnose whether you have low thyroid or not.
And, you know, I had been tested for many years. My thyroid, my TSH always looked great.
And
yet, when I did the comprehensive panel, you pointed out to me very clearly, no, your thyroid is low, and we can tell it, and then we can match your symptoms up to it, and it all makes sense. So yes, and my story is not unique. This happens time and time again.
Hi, I'm Maggie, UMD, and I'm a functional and holistic medicine physician and the creator of the Transform and Transform protocol. If you're interested in learning what are the root causes of all chronic disease, go ahead and click the link in the description where I have a power-packed 30-minute training that goes over what are the 5 pillars of Transform. Go ahead, click the link, and I'll see you in that training. Did you know, okay, the thyroid, just the thyroid, little butterfly here has 6,000 targets of autoimmune attack. 6,000, okay? So it's not just like 1, 2, or 3, okay? So did you know even the best laboratory on the planet has only 11 of the targets that's testable by blood? And most laboratories only offer 2 to 3 targets of autoimmune attack testing. So here's the interesting thing. How many of you guys had a TSH, never even had autoimmune testing done, those 3 tests? And you're just told your thyroid is normal with your TSH. You don't have an autoimmune issue going on with your thyroid because we didn't even bother testing for it, or we tested those 3 labs and you were negative. I'm going to ask you something. What are the odds with all the symptoms of low thyroid and your TSH is normal, right? And you test 3 out of 6,000 targets, what are the chances that you don't have an autoimmune attack of your thyroid going on when only 3 out of the 6,000 targets are even tested? I mean, seriously, less than 1% of the targets tested, they tell you you don't have any problem with your thyroid. And in fact, you don't have an autoimmune attack against your thyroid. What this tells you is, even if you had the autoimmune testing done, that doesn't mean you don't have an autoimmune disease of your thyroid. In fact, did you know, I'm going to tell you guys right now, all of you that have low thyroid, latest studies, 90% of you have autoimmune related low thyroid. Regardless of whether you tested positive or if you even had those 3 tests done on those 3 targets, at least 90% of people with diagnosed low thyroid have autoimmune disease of the thyroid. So what does this tell you guys? How likely is low thyroid an autoimmune disease?
How likely?
At least 90%.
Pretty likely. Yeah.
And Kathy, I mean, Kathy's in Canada, right? And this isn't just a United States problem. This is an international, global problem. This is why our programs are global and international. But if the expert on the thyroid, who treats thyroid? Most of the people with low thyroid treated by primary practitioners, family practitioners like I used to be, right? Or they're being treated by endocrinologists, medical doctor as well, right? And none of these doctors, whether they're primary care doctor, family practitioner, or endocrinologist, have any training around an autoimmune attack of the thyroid. They're only trained on how to use the TSH, only the TSH, to adjust the dose of thyroid medication if you need it. That's the only skill they have.
The interesting thing is I feel like what every doctor does is I mean, and most of them don't even test anything more than the TSH. But even if you do go to an endocrinologist and they do test some of these other things, all they do is they look down the line, see what your numbers is. Oh, is it showing up on the lab report as high or low or out of range? And that's all. And it's like, no, everything's in range. You're good. thank you. And that's it. That's it.
Well,
That's
and
as much as we get.
Well, and here's the other issue. I also see people going to naturopaths or functional medicine doctors to quote unquote get their thyroid checked, right? And yes, there are absolutely bigger lab panels that should be done and not just TSH. I think it's really critical that people get, number one, the right thyroid test, and it's way more than TSH, right? There's certain parts of T4 that should be tested. There's T3 that should be tested. There's also autoimmune labs that should be tested. But my most important thing is not even just what labs, it's what's the pattern the labs are showing. Which part is the dysfunction happening? I go even deeper because I'm like, okay, what are the optimal levels of these labs that your doctors never do, number one, right? And we do it in our programs. What are the optimal numbers for them for you to not have those symptoms, right? For your cells to function properly, for your cells to actually be lock and key turned on, right? What is the optimal level for that? But I also think about, okay, if this number is this and this number is this number is this and that number is that, and you have these other symptoms, what is this pattern? What is the real cause of this person's problem? Right? I
There's
remember
the superpower. You're always able to spot these patterns, Dr. Maggie, and get to the root cause of why these issues are happening.
you have to. I call it the thyroid, the devil you don't know, right?
Yeah.
I can tell you 100% of patients, clients coming to work with us on their thyroid, whether it's in our main program or in our new upcoming program, whenever someone works with us on our thyroid, it's like this huge eye opener, and they realize just how big of a devil this whole problem really is, and how much ignorance there's out there, and how much people have to battle their doctors. They actually have to fight their doctors to actually get the right labs, the right understanding of the root cause, and the right treatment, right? So for me, like really importantly is everybody who's been through our programs know how important education is. But the first thing is the right data. And I see a lot of questions here around testing. Well, I'm going to go ahead and let you guys know that in my thyroid masterclass, I call it 4 months to total thyroid transformation. You're going to be working with me and our team for 4 months. We're going to have a comprehensive test kit. That's a blood spot test that's going to be mailed to your home. And this is international. We have clients all over the world. We can send the exact testing and the complete testing that you need for your thyroid to you internationally. Number two, there are expert video modules to learn all different aspects of thyroid health. Think about this as a master's degree, right? And I love playing full out. Kathy loves playing full out and Dr. Jason. It's really important to take your data, your history, and your symptoms and present it to us and ask us questions live. So we get to put it all together because every single case is unique. Okay. Every single case is unique. So what I find is, let's say Jill's case is going to be different than Agnes's case. It's going to be different than Loretta and Mary Beth's case, because the things that's fueling one person's low thyroid is very different from another. Hey, if you really enjoyed what you're watching and you want to learn more about this topic, make sure you check out, if you're on YouTube, some of the suggestions for what to watch next right here. And if you're watching on any other format, feel free to comment in the comment section. Our team and I will get those resources to you. And if you haven't clicked subscribe yet on YouTube, make sure to click subscribe and ring the bell so you get notified every time we are live. Thanks, everyone.